The fast-spreading Delta variant causing worries about another possible COVID wave. How to protect yourself as restrictions lift and summer break kicks in. Good evening, I'm Brian Hackney.
And I'm Elizabeth Cook. Joining us now is UCSF infectious disease specialist, Dr. Monica Gandhi. Dr. Gandhi, thank you so much for joining us this evening.
Thank you.
So let's talk about the transmission of this Delta variant. How is it different from the original virus, and how quickly is it really spreading?
You know, the way to think of the Delta variant is that this strain is more fit. And what that means is it's going to outcompete any other of our Alpha variant or even the ancestral strain. And so it will rapidly, as it has, become the virus that can infect unvaccinated people. It will not infect vaccinated people because really your immune system is going to hold up against that Delta variant.
And California's positivity rate creeping up slowly after a low 0.7%. We're now at 1.2% with months of summer travel, though, and upcoming holidays. Should people be taking extra precautions? Should we be wearing the masks, even though many of the restrictions have been lifted?
You know, the way to think of that is that it's likely not the Delta yet, because actually less than 5% of our particular variants in this state are the Delta. It's more that, yes, this was to be expected. If we opened up, if we saw more people, that cases may slightly go up. But the important thing, and this is really important, is what Governor Newsom said when he opened our state, and actually said this back in April when he was planning on opening it, is we were going to track hospitalizations and deaths. We were going to make sure that our hospitals in no way see increased cases of COVID-19. We have not seen that at all. So a lot of people are swabbing people's noses even after they've been vaccinated. The Delta can creep in there, but you're asymptomatic, you can't spread it. And that's actually why the CDC is asking us not to test people who are asymptomatic after vaccination, because it's unclear if that's a case or we just killed it in our nose.
I think a lot of people may be watching this and being a little worried that they're remembering early 2020 of when things started closing down. Kids were out of school. They weren't able to go anywhere. The whole world was locked down. Any chance that this Delta variant could do that to us again?
You know, no, because we are in a completely different place. What was going on before, right, is that we had no immunity in the population. We didn't have vaccines. So we'd open up. Things would get hard, cases and hospitalizations would go up, we'd have to close. Open, close, open, close. What's going on now? We have 70% or more of first dose across all of California. We have 83% first dose across the Bay Area. There was a seroprevalence study done in California yesterday that showed that 85% of us are immune. Combination of vaccine and natural immunity all throughout the state. What that means is those who are unvaccinated may see the Delta variant, but we are not going to see those surges. We are not going to see those hospitalizations. The difference between then and now is that we are immune. We have immunity in our population. I know it feels scary because last year was terrible, but we're in a different ballgame.
That's great to hear. Let's talk about these vaccines. For the folks who got the one-dose Johnson & Johnson vaccine, will they need a booster shot, do you think, to protect them against this new variant?
You know, that is really unclear to me. I know a lot of people have been saying that. The thing that I remember about the Johnson & Johnson vaccine from the phase 1-2 studies is that the CD4 counts, well, those are the T cells, and the antibodies go up over time. They keep on going up. It really is like a vaccine that keeps on giving. So it is unclear that you're going to need a booster with an mRNA vaccine after Johnson & Johnson, because it's not the same as AstraZeneca. One dose gives you a lot of protection that keeps on going up. So I wouldn't actually advise that yet until we've seen evidence that we have more breakthroughs with the Johnson & Johnson vaccine. There's no evidence of that yet. The CDC said it's not stratified by type of vaccine. We don't have more breakthroughs on Johnson & Johnson.
Earlier in the newscast, we reported that the Moderna and Pfizer vaccines, those two-shot vaccines, could actually protect us for several years to come. Do you anticipate us having to get another type of COVID vaccine every 5 years? Do you anticipate that happening eventually?
It's possible, but I will tell you what you were referring to, that amazing study that just got published yesterday that showed us that memory B cells after vaccination are formed in our lymph nodes. Memory B cells last a really long time. There was actually a study that showed us that people who had gotten influenza in 1918 had memory B cells that still worked 90 years later. They published this in 2008. These were 90-year-olds, 95-year-olds. So they can last a really long time. And the fact that memory B cells are formed by these vaccines, which is great news, just a study yesterday, and also that there was another study from Oregon last week that showed that memory B cells will produce antibodies directed against whatever variant you have. It's not like they're going to produce antibodies against some old strain. They're going to see what you have and produce the right antibodies. That to me makes me wonder if we'll never need a booster. I will say that we're going to be tracking this. We're always going to watch for breakthroughs. And if we see that immunity wanes, we will give boosters. But I don't see it for 5 or 10 years.
All right. Dr. Monica Gandhi helping us all lower our stress levels just a little bit this evening. Thank you so much for joining us.
Thank you.